lifestyle and behavior are important parts of health, both prevention and treatment. You know, everybody knows this. They hear every day that they should eat better, they should exercise, that, they shouldn't stress out and relax, they shouldn't smoke or drink too much. This is common knowledge. But the question is, how do you actually make it happen in your life so that it's a natural part of your habits? It's not something you're struggling for.
Hello, everyone, and welcome to Get Well and Stay Well as we explore different dimensions of how healing works. It's my great pleasure to have with me here Jennifer Bires, who is a licensed oncology social worker at the Center for Cancer, actually Life with Cancer, it's called, and patient experience at the Inova Shar Cancer Center. It's a topic that is very important, and I think that the discussion on this area, I think, is key. Let me just tell you a little bit about Jennifer. She's a licensed social worker with special training in oncology and oncology care. She'll tell you a little bit about Life with Cancer and what it does. Before that, she worked with a wonderful center called the Smith Center for Arts and Healing in Washington, D.C., and she specializes in an important area that is often neglected in cancer, and that is young adults with cancer, a very special population. We don't think about it as much because the majority of people that get cancer are older, but there are many young adults that get cancer, and it affects them in particular ways. Her work has been acknowledged a number of times, but especially with the prestigious 2017 Oncology Social Worker of the Year from the Association of Oncology Social Workers. Jennifer, welcome.
Thank you. Glad to be here.
So before we get into some of the questions and activities and actions that we're going to talk about today, I'd like to ask my guests sort of how they personally got involved in this. How did you get into this area of cancer work, especially social work in cancer, and sort of what was your journey to that?
Cancer impacted my family really early. When I was 13, my mom was diagnosed with cancer and ultimately ended up dying from it. And I think watching how it impacted my family, I knew it was an area that I really wanted to work in and be a part of. I didn't want to be a doctor or a nurse, so I had to figure out another way to support people who'd been impacted by cancer. And social work was the way in. And so I started, I went to social work school and did all of my practicums in oncology, and I've worked in oncology since I joined the field.
That's great. The word cancer, more than probably any other disease that can afflict people, is tightly associated with the word fear and the phenomena of fear. And I think that's, partly because of the disease itself is something that's slow and sort of creeps up on you a lot of times. And it's also partly because of the treatments that we get, which sometimes can be, as harsh or almost as harsh as the cancer itself. Is how do you deal with fear? I know that's an area that affects everybody, and even more so the families. Can you talk about some ways in which fear can be dealt with and coped with when someone hears the word cancer?
Yeah, I think cancer is really scary. And a lot of that is because there's so much uncertainty, so many unknowns, and really it feels a lot of control has been taken away. And so when people come to us, they are scared about what's going to happen, what the future will look like, how they're going to feel. And I think there's a lot of ways that people can deal with fear. One is just talking about the experience. Sometimes when we're having conversations in our head instead of having them out loud, things can get bigger or seem scarier than they are. Also, information and knowledge. So being educated about what's happening, talking to others who have gone through a similar experience so that you know what to expect can be helpful. Having a health team that you feel confident in can be important. A good support network of family and friends, and also taking control of the things you can, like nutrition and exercise or support, can be really helpful in managing fear. And then a lot of programs that we utilize at Life with Cancer, but really across the country, involve mindfulness, which can be another helpful approach. But there's, not one thing will work for everyone. And so I think really trying to develop a plan that works for you can be really important, but that'll take some work just figuring out how to put all the pieces together.
Oops, there we go. I think that the idea that mind-body practices can help mitigate this are important, and engaging in mind-body practices is something that we try to teach all of our patients how to do. But it's more than that. I mean, it's the social and emotional life. Very often people start questioning, well, why am I here? I mean, they get into spiritual questions or things that they haven't really paid attention to as they've gone about their busy lives. And are there things that you've done in your career and that you do at Life with Cancer to help them get at those deeper aspects and understand sort of the meaning of their situation and their life now?
I think probably one of the most important things that we offer is one-on-one therapy with a licensed therapist. So that gives patients and family members an opportunity to start to think about those things that you're talking about, the spiritual issues that come up, or the experience that they're going through, really to process it and find meaning along with it. We also have a lot of educational classes that help teach mindfulness, journaling, pieces that can help you start to look at what's happening with you. And then some of those programs I talked about that help you learn techniques like mindfulness, or using cognitive behavioral therapy to start looking at some of your thought processes. Art therapy. I mean, there's a lot of ways to really get into what's happening and start to process it. I think oftentimes people are so overwhelmed with what is happening to them that that they kind of get into the medical track and they're just worrying about what treatment is next or what appointment is next. And so finding time to deal with both the emotional side of what's happening and the medical side of what's happening can be really overwhelming.
Great. Yeah, you mentioned briefly their art therapy. My wife has had cancer several times, and she uses the Life with Cancer Center there. And the last time she was in for a checkup, one, I think, of your folks that you work with actually came up and offered her to do a little collage while she was waiting. Now, she never thinks of herself as an artist. She doesn't think she can paint or draw or anything like that. But she produced this beautiful collage that she brought home. And it actually had all these very meaningful components to it. We had a long conversation about that. And so that's an example of something that most people don't think about, right? But it can have quite profound effect. And it allows sort of the unconscious part of your mind to speak. The words, can sometimes not quite get at the deep feelings and meaning that's going on. But so I'm a big fan of the art therapy work that you do over there. And sometimes people don't want to be in a group where they talk about their cancer with other folks, but they can, deal with things creatively and express themselves in those areas. So appreciate that. Tell us a little bit about the kinds of services. Tell us about the Life with Cancer Center that you run right now. I was very impressed by the services that you offered over there, and I've been to a number of places. I've taught at cancer centers all over the world. but you really have put together quite a list of support services there. What's the purpose of the Life with Cancer Center? What are the services that you offer? Who can access them? How has COVID affected that, which I know it has? Can you tell a little bit about the Life with Cancer Center?
Sure. We feel really fortunate of what we can offer at Life with Cancer and really proud of the services that we have. Everything that we do at Life with Cancer is at no charge to the patient and their family. And we serve people who are treated at the Inova Shar Cancer Institute, but really people who are treated anywhere. We used to say folks who could get to us because all of our services used to be offered in person, but now a majority are offered through Zoom. We do about 150 programs a month, and that includes fitness programming, nutrition programming, educational programming, and support groups. We, as I mentioned before, have a number of licensed therapists on our team, as well as nurse navigators and dietitians that can help support the whole patient through their diagnosis with either group work or one-on-one work. And our programming really ranges from mindfulness programming, fitness programming, nutrition education, really all of the components that we think are important for someone going through a cancer diagnosis. We also have a strong adolescent and young adult program that supports young adults who've been diagnosed with cancer, also children who've been diagnosed with cancer, and children of adults who've been diagnosed with cancer, which can be an important piece. We know cancer can be extremely isolating, and so oftentimes what we're trying to do with the program is plug people into a different support that'll be helpful to them. So like Dr. Jonas, you were mentioning the art piece. We know some people are really gravitate towards art, and others may gravitate towards something that is more scientific or logical in nature. Art has a great scientific base behind it, but we all have different components that are important to us in our healing. And so really working to make sure that we have the pieces that can be important for anyone.
Yeah, great. So we're going to get to questions from the audience in a bit, but one just came in specifically on this topic. And in order to make use of these services that you talked about, does an oncologist have to refer you?
No, a lot of our patients are referred by their oncologist, but many self-refer. They may find us online, they may see literature in their doctor's office. And so really anyone can reach out to Life with Cancer to receive support. We do have some, while our support can be accessed on a national level, there are some licensing issues, like our one-on-one therapy support. Our nurse navigators and dietitians oftentimes can't provide one-on-one support to people outside of the DMV because of where their license are held. But any of our group programming oftentimes can be accessed from anyone, especially because most of it's on Zoom right now due to COVID.
Yeah. So you mentioned nutrition, and I know that's a very confusing area for people a lot of times. What should I eat? Should I, stop eating? Should I eat more? Should I eat more protein, more carbohydrates, ketogenic diet, supplements, et cetera, et cetera? Do you have professionals there that can give us give people a good scientific base? And are some of those things also online?
Yeah, all of our dietitians are oncology certified dietitians, and so they specialize in using the science that exists to give people really good advice as they're going through treatment or they're into survivorship. And we also have groups or educational groups that happen online, and so there are different ways to get that nutritional advice that people want, so that they know what foods they can or should be eating and how to best tailor what they're going through to their nutrition.
Great. Well, I know for the last year you've been working with us in something called the Integrative Oncology Leadership Collaborative, and I'm very glad to hear that you do get a lot of referrals from oncologist teams to Life with Cancer. Our experience is that the oncologists actually have no clue that these services are around, much less actually make recommendations. That when someone comes in with a diagnosis of cancer, they're often so, and appropriately so, laser focused on the tumor, right? And kind of get rid of the tumor in various ways that, the rest of the person tends to get neglected. And one of the purposes of the IOLC, the Integrative Oncology Leadership Group, is to try to make that process of whole person care of a person with cancer more routine and regular and standard in oncology practice. As you know, a collaborator of ours, and we have just published an article showing that even if you just provide the basic kinds of person care in terms of behavior and lifestyle, psychosocial support, that you've just been talking to, that there's actually not only better quality of life, but even longer life. You don't actually have to have everything under the sun, an alternative. You just have sort of the basics of stress management, nutrition, and activity, art, like you've talked to in those areas. How do we get oncologists and oncology teams to get this and actually make it standard part of what they do for everybody that they see? What have been some of your approaches that you found helpful?
Wow, that's $1 million question, isn't it? I think what I would say, and positively, we've seen a significant shift in oncology teams paying attention to whole person care in the last 10 years. I would say that there are places like the Commission on Cancer and accreditation bodies that are trying to make sure that these pieces are standard of care. I also think it's important for patients to advocate for themselves and to really talk to their providers about how helpful services like paying attention to their emotional well-being have been. And so I think, as we evolve and as people like you publish these important articles showing how important this care is, we're going to see more and more oncologists referring patients to these services. But I also think patients will have to advocate for themselves and make sure that they are talking to their teams about what's important and what's helpful as we continue to move forward together.
Yeah, so being your own advocate or having an advocate that's with you sounds like is really important. Is there a guide to this? I mean, it's very difficult to, once you're diagnosed, you come in and suddenly this entire world descends upon you. The oncologist and their team seems like they hold all the power in those areas. So, you want to get the best care possible. Is there a guide, or do you all have a guide, or maybe we need to develop a guide for how to become your own advocate once you're diagnosed with cancer, to make sure that you're working closely with your oncologist, but at the same time getting, the other kinds of care that they may not be talking to you about? Is there a guide for that? Is that something Life with Cancer helps with?
It's certainly something that Life with Cancer helps with. And this is one big reason why I really recommend that people get into support groups. I know oftentimes people say, like, I'm not a group person, or I don't want to be in a group of people. And while they're not for everyone, groups really give people a real opportunity to learn from other patients who have been through a similar experience and learn what questions would be good to ask, or what challenges other people have had, so that they can be aware of that. Every situation is so different that there's not necessarily a specific guide for people to use, but there are different tools at different places. Like for young adults specifically, there's some really great young adult organizations. I know, Dr. Jonas, your organization has been working on a guide that I think does a great job of walking people through what questions to ask their providers and what issues like fertility or like insurance and job issues to be aware of, like sexual health, some of the really big issues that we don't always see addressed in oncology offices. And so finding different organizations or patients who have been there before you can really be helpful in knowing, one, what to expect, and two, how to advocate for yourself or what questions to ask your providers. I always recommend that people take a person with them to appointments. This has become increasingly difficult with COVID, when a lot of offices are only allowing one person into the appointment. But calling someone on the phone when you're in there, or really having someone help you take notes and listen with you, can be important in helping you advocate or formulate your questions, because, when you are with a doctor and things are moving very quickly and you only have a short amount of time and you're getting new and sometimes stressful information, it can be easy to forget things or get caught up in the moment and not ask your questions. And so having someone there to help you can be really important.
Mm-hmm.
I also recommend that people write down their questions ahead of time so that you're going into the appointment ready. You could even make a copy and hand the doctor the copy before you walk in. Some physicians love this and some don't love it as much, but it really helps align everyone with what is going to be important in that visit. And another important piece that I think the IOLC has really called attention to is, what is most important to the person in the room? And so as a patient, I think making sure that you help your providers know who you are as a person and what's important to you can be key. And so even if they're not asking those questions, or they may be asking them in different ways, taking a moment to say, this is who I am and this is what's really important to me, can help that provider really make a treatment plan that will be tailored to you and your success.
Mm-hmm.
And so those are some of the key pieces that I think can help people really take control and be ready for their treatment.
That is fantastic. You just summarized the essence of a guide there. Thank you very much. Why don't we do one together, okay? As you know, in the ILC, we've been creating a number of tools that we call the healing-oriented practices and environments, the Hope Note for cancer care. And it's a set of tools and resources that attempt to give both the oncology teams as well as the patients sort of guidance and processes and to allow this to happen on a standard and routine basis. But I think actually having a guide along the lines of what you just described would be ideal. Maybe we'll add that to that if you'll help us in that. Having someone come is important with you, I think, because you hear different things. And it's important to have someone that you trust, that you can work with, that can, in many ways, sort of be your advocate in those areas. Now, I know that you have specialized a lot in working with young people with cancer, and this can be especially, excuse me, difficult and isolating because you're not supposed to get cancer when you're young, right? You're supposed to go on with your life. You've got your future ahead of you, et cetera, in those areas. Tell us a little bit about, specifically how young people who have been diagnosed with cancer can kind of get the help that they need, and what you'd recommend for them, specifically. What are the key issues that come up that young people face that maybe older people are not so key for them or important for them? Can you talk a little bit about how a young person can get the resources and the support and the access to information that they need if they're diagnosed with cancer?
Sure. I think, like you mentioned, cancer can be incredibly isolating and difficult for anyone at any age when they're diagnosed, but for young adults, that is especially true. And I think there's a number of reasons that that's the case. One, it's a smaller population of people. And so when we think about cancer, we often think about it as an illness of older adults. And so when young adults are diagnosed, they may not have any friends who have had a similar diagnosis. They may not know anyone else with cancer. Oftentimes they talk about walking into the infusion room the first time and really not seeing anyone that looks like them. And that can be scary and isolating. Also, they're at a time in their life when they are starting new jobs or new relationships or in the middle of school, and these things have to come to a stop or be changed or shifted. They may have to move back home with their parents. Their autonomy or who they are becoming as a person essentially gets stopped. And that is really difficult to manage, going to all the medical appointments and making major medical decisions while a big part of their life has shifted or changed, and their friends may not understand what they're going through. They never experienced something like this before, and so the people that they used to count on may not quite get what's happening, or they may be moving on with their life really quickly in a way that the young adult who has cancer feels like they can't do. And so it just creates a lot of complicated feelings, emotions, and difficulty in getting support. And also, we know that most of the treatments that have been developed for cancer were developed for older adults. And so they haven't really even been studied on this young adult population. And so the side effects could be different and what they're experiencing could be different. And all of this just makes things more complicated. And then there are fertility issues that have to be thought of. There are sexual health issues. There are oftentimes people at this age group may go out to bars together or restaurants. And so there's major questions about, will people feel well enough to socialize in that way? Can they drink alcohol? There's just a lot of questions that are happening that can make things more difficult. And so I think, really making sure that people have access to good behavioral health, emotional and mental health, whether that's through a therapist or the support groups that I've talked about, so that they are meeting other young adults who have gone through a similar situation. Depending on the diagnosis, there's all kinds of great Facebook group, meetup groups, chat groups that can be really helpful. And of course, those have pluses and minuses because, when you start going online and meeting people online, you can get a lot of really incredible information, and you can also get really scary information or misinformation. And so making sure to balance those things can be important. But I think the most important thing I can say is that oftentimes young adults feel very alone when this happens. And while it is a very alone experience, there are people out there that can be helpful with it, whether it's other young adults who are going through cancer or professionals who can be helpful, and really for people to reach out. I hear so often from people, I wish I would have joined the support group sooner, or I wish I would have reached out to talk to someone sooner. And so really encouraging people not to wait, but to really reach out and start building those relationships, even when it feels like one more thing they have to do on top of their diagnosis, can really make the difference between going through the experience in a positive way or in a way that feels really challenging.
Yeah, that's great advice. I think I would add to that a lot of times young people and the cancer treatment teams that they engage with are focused again on sort of the immediate management of their cancer and that kind of stuff. But we're able to treat cancer now more and more, get rid of it, et cetera. And people are living a long time with it, right?
Yeah.
So thinking about the long-term future, I think is key. I know my wife had breast cancer at 35, and she was a young lawyer, 3 young kids, just starting her career. And boy, that kind of threw her off, right? I mean, she started to experience a lot of the very things that you just talked about in those areas. And but her journey brought her really through to a different place. She began to get much more involved in the school. She got a pastoral counseling degree and began to help out service members and their families in those areas. Very, very fulfilling activity that she continues now to this day. It's not a lawyer downtown in Washington, D.C., which is where she was working at the time, but it is equally and in many ways more deeply fulfilling. And now, sort of 30 plus years later, we started thinking, boy, that was a long time. There's a lot of stuff that can happen there, and other types of things in your health shouldn't be neglected, right? I mean, the prevention components around heart disease, around preventing, overweight and diabetes, all those standard things that young people tend to neglect anyway, because until they get older, but especially those kinds of things need to be addressed. Preventative care, appropriate monitoring, not just of the cancer, but of other conditions, to make sure you're engaged in a healthy lifestyle, separate from just the cancer diagnosis, because the likelihood is that you're going to you increasingly live a long time with that type of thing. So
I think you bring up some important points, because we do see people make major pivots. Like, cancer can give people a real opportunity to reflect on what's important to them and to shift where they're passionate about, and to live a life that's really meaningful to them. And for some people, they say the pressure to do that is overwhelming after a cancer diagnosis. And so really balancing those things about knowing what's important and also being really compassionate and gentle with yourself as you're going through that process of figuring it out and making life choices. And also this idea of really taking care of yourself through a cancer diagnosis and post-cancer diagnosis. And I think we hear a lot about the word survivorship and a lot of survivorship clinics popping up, but finding a way to live a healthy lifestyle through exercise, diet, and stress management can be really important and overwhelming when you're managing cancer at the same time. And so finding small ways to weave these things in can be really helpful as things unfold and life develops into what it's going to look like as you were describing.
That's fantastic. I know that when very often after you've been involved with cancer, you've learned all these things that you've talked about. You've started to take care of yourself. The cancer's being treated or been treated. You've engaged in the support group, and you're engaged those things. You feel empowered, right? A lot of times you feel like, hey, yeah, I know how to handle this. I know how to do this. My life is doing pretty good and doing well, and sometimes even better afterwards. But then there's these little social groups called friends and family, right? And they may have not been through that experience. And sometimes they actually may have more fear and be helpful or not helpful. We talked about the importance of being an advocate and maybe having an advocate that you trust with that. But don't you also have to protect yourself from folks that maybe don't get it and are still wallowing in the fear itself and might be aggravating that if you interact with them? How do you deal with that kind of thing?
Yeah, that's something we hear about a lot. And I think people really, fortunately or unfortunately, have to find their voice after a diagnosis. And that may be in setting boundaries around who you will talk to or who you won't talk to, or telling people exactly how you need support, whether it's, I need transportation and meals, but I don't need you to send me articles. I have a medical team that's taking care of that. Or I need you to sit with me when I'm not feeling well, but I don't need you to give me any advice. And so really figuring out what would be helpful and what is not helpful and setting boundaries around that. I think for some people that's really hard to do. And so enlisting friends or family members who do get it to help them, to have them help you set some of those boundaries can be important. But people are really well-meaning, but oftentimes don't have the right thing to say. And really protecting your space and what you need at the time can be really important, because going through a cancer diagnosis takes an incredible amount of energy, and spending that energy on people that are not giving you what you need can be really detrimental.
Yeah, no, I think that's really, really good advice. What I hear you saying is that learn how to be specific and also learn how to say, I don't need that. Those are two really hard things to do. Say, I need that, I don't need that. And if people can't comply with that, sometimes you have to say, well, I'm not going to associate with that person anymore for right now anyway. And it doesn't necessarily mean it's the end of the relationship, but it means for right now, this is how you set your own boundaries, how you deal with that. Well, I mean, cancer, it does kill people. Okay, there's no question about that, as does many other diseases, but it's one that we kind of see coming sometimes. And so that in many ways allows us to deal with it. I think in a way that if you were to have a sudden car accident or heart attack or something like that, you wouldn't be able to do. And so dealing with the end of life and finding quality through the end of life, I know is something that you have worked specifically within for a long time. If somebody listening here is working with or facing that situation themselves, what's some advice that you would give them as we end the show?
Yeah, I think anytime someone hears the word cancer, they think about end of life or death. And that's one of the reasons why cancer is so scary to us. And for a lot of people, they're going to go on to survivorship. But I would say advice I give to everyone is that we should all be prepared for what that may look like. And that is completing an advance directive, having those conversations with the people that we love who may be making decisions for us when we can't. can go a long way in helping ease some of those fears and not having to make really rushed decisions at the end. Talking about end of life is oftentimes the elephant in the room. I think there's this thought that if we talk about it, it'll make it happen sooner. And we know that's not the case. And so taking away some of the power that has by having meaningful conversations can be really scary, but also really important when dealing with a cancer diagnosis. And so really, having people do their advanced directives, having people have these conversations. And I always tell people, it's not just a person who has cancer who should be having these conversations. It's really everyone in the family. When I give people a copy of an advanced directive, I give them 3 or 4, because just because you have cancer doesn't mean you're the only one who needs to be doing this. Like you mentioned, car crashes happen, other illnesses happen. And while cancer brings this to the forefront and makes it something, that people start to focus on, really, we should all be doing this and taking care of these things. And so maybe cancer is the opportunity sometimes that everyone who's providing support could take it as an opportunity to do that.
Yeah. So cancer or no cancer, end of life is a fact of life. And we should, the more that we can become comfortable with it and live realizing that potential for a higher quality of life is there. And, you've mentioned support groups a number of times, and I think the support groups are often the way that we get that kind of social and emotional support. We talk about those things that are difficult to talk about. I understand you're running a support group today. Is that correct?
Yeah, I do. I have one this evening through Smith Center for Healing in the Arts. So if there's anyone out there who's looking for a support group, I think that's certainly one to check out. And then, Life with Cancer also has a number of support groups specifically for young adults. But I really do encourage that people find the support that they need, because mental, emotional, and social support is equally important as medical care.
Well, thank you. And so all this information and more information is available both at the Smith Center, which we're posting right now, as well as Life with Cancer there at ANOVA. Is that correct?
That's right.
Great. Well, listen, thank you very much for talking to me about this very, very important topic that really touches, probably between a third and a half, if you include the family members of everybody around, right? So it is something that almost all of us will either face one way or another, either with a family member or ourselves. And so really learning how to go into this with tools, resources, and skills that can take away that fear is important as a life skill, I think. So thank you very much. And, great work that you're doing. And we'll have you again and really appreciate you being on our leadership group, too, to make this kind of care routine and regular for those with cancer.
Yeah, thank you, Dr. Jonas. I really appreciate that this is being highlighted, and think that we can continue to make sure people know about what supports are out there so that they have what they need when they need it.
Thank you. Take care. Have a good day.